Module number 9 is on the Public Service Loan Forgiveness Program. There is a whole lot of incomplete and outright inaccurate information about this program. Maybe it's because I work with it very closely, but I don't think this program is nearly as complicated as a lot of people make it out to be. So let's take a good look at the Public Service Loan Forgiveness Program. PSLF, as it's called, is designed to encourage borrowers of any degree, any discipline, to work in the public nonprofit sector for at least 10 years with the promise by the federal government to forgive any debt that remains at that time absolutely tax-free. The forgiveness amount, again, is not considered taxable income. That's one of the huge benefits of this program. As mentioned, it has nothing to do with degree. It has nothing to do with specialty. Someone going into surgery could qualify as easily as someone going into family medicine, psychiatry, etc., etc. It has everything to do with whether or not you meet the requirements that we are about to get into. The Public Service Loan Forgiveness Program was actually passed into law in 2007, and as we go through this, I think you will see that, at least based on our experience, there are more than a few medical school graduates who are queuing up and about to qualify for the Public Service Loan Forgiveness Program because of how long it's been in existence. So let's take a good look at it. Let's take a look at the eligibility requirements for PSLF. And folks, don't let anybody tell you it's complicated. It's really not. These are 3 things that have to happen, and they have to happen at the same time in order for you to qualify for PSLF. Think about PSLF as a clock that has to tick 120 times, and the clock is not going to move forward unless all 3 of these are happening at the same time. You have to make 10 years worth of payments, 120 payments, with an eligible repayment plan. You have to use an income plan to qualify. It doesn't have to be the same income plan. For example, you could pay with repay for 3 years, then switch to pay as you earn. The clock does not reset. You only have 7 years left. The 120 payments, you can't shorten that time period, but those payments don't have to be consecutive. What if you paid for 3 years, then needed a 6-month forbearance? The clock will simply pause at 3 years, and when you start paying again, it picks right back up where you left it. The payments have to be on loans the government made. They can't forgive loans they didn't make. So eligible loans are direct loans. Look at your student loan portfolio. If it says direct loans, those loans qualify. If it doesn't say direct loans, they don't. And every time you're making a payment with an income plan on direct loans, you have to be working full-time for an eligible public sector nonprofit employer. The employment doesn't have to be consecutive. But again, the clock is not moving unless all 3 of those things are happening at the same time. And please don't take this the wrong way, but the obvious reason many medical school graduates are interested in PSLF is that well over 90%, and I think last year it was actually around 97%, of the teaching hospitals where you guys match are, guess what, 501c3 nonprofits. So the idea is, if you're going to use an income plan anyway, and you have direct loans and you matched into a nonprofit teaching hospital, you're kind of sort of qualifying for PSLF whether you ultimately use it or not. So those are the requirements for the Public Service Loan Forgiveness Program. So how do you enroll or participate in the Public Service Loan Forgiveness Program? Well, unlike the National Health Service Corps, the Armed Forces, NIH, the Indian Health Service, these are organizations that are service commitment programs where you sign a contract and they give you money to help you pay your debt off. Those are not forgiveness programs. Those are loan repayment assistance programs. With PSLF, you don't sign a contract swearing that you're going to stay in the public sector for 10 years. You simply make payments on your loans and you track them by enrolling in public service loan forgiveness. You simply fill out the PSLF form. You see the website where it's available, studentaid.gov/public service. You should do this every year. And you send it to Fed Loan Servicing, whether or not Fed Loan Servicing is your loan servicer. When Fed Loan Servicing gets it, they'll confirm that your employer is an eligible employer, and they'll transfer your loans from your current servicer to their servicing system if they're not already your loan servicer, because that allows them to track the payments that you make to them. They will notify you in writing of their actions. So all you're doing is you are enrolling in the Public Service Loan Forgiveness Program. You're letting the government know that, hey, I might be interested in public service loan forgiveness. Track my payments for me so I know every year how many payments I've made and how many payments I have to make to qualify for PSLF. We would strongly encourage you to do the PSLF form at orientation. Your house officer, program director, GME director, they have done many of these. This is not something that is new to them. If you do this early enough, then Fed Loan Servicing should have your loans by the time you make your first payment in the fall. It's much easier to track your payments if your very first payment goes to Fed Loan Servicing. So if Fed Loan Servicing is not your loan servicer, please be sure that once you start your residency program, that you complete the PSLF form and get it to Fed Loan Servicing so your loans can be transferred to them before you make your very first payment. And be sure you do the PSLF form every single year. Now, some comments on public service loan forgiveness. Folks, don't make it a complicated program. It really isn't. You saw what the requirements are for eligibility, and they're really not complicated. You saw how you enroll in the program. Be sure your loans are with Fed Loan Servicing so that when you start making payments, which you would do anyway, unless you decided to postpone, if you start making payments, you're preserving the option to use PSLF so that when you come out of training, you can look back and go, I've got 3, 4, 5, 6 years worth of payments already in toward PSLF. If you land in the public nonprofit sector, then you've got a minimal period of time to go before you qualify. And most of the residents we talk to say that their real decision about PSLF is likely going to come toward the end of residency or fellowship as your career plans are taking shape. So again, you're not signing a contract. You are simply preserving the option to use PSLF by making your payments in residency and fellowship. We always hate not to encourage aggressive repayment, but while PSLF is on the table as part of your repayment strategy, aggressive repayment makes no sense. A reminder, the forgiveness amount is tax-free. Don't let anybody tell you otherwise. And lastly, we would strongly encourage you to read our statement on PSLF on our homepage. We address the proposals on the program, updates on the approval percentage. The high percentage of denials, although accurate, is terribly misleading because many of the borrowers who were applying for PSLF had the wrong repayment plans, the wrong kind of loans. They left information off the application. You guys know exactly how to qualify, and you would never turn in an application for PSLF until you knew you'd met the requirements. Also, any adverse changes to PSLF, if there are any, would likely only impact first-time borrowers. The Biden administration is supportive of PSLF, but watch our webpage, PGPresents.com, for updates on PSLF. Now, I made mention early on in this module that we anticipate many medical school graduates are in the queue to qualify for PSLF over the next few years. Let me tell you my rationale there, and we get into this on our homepage, pgpresents.com, on our statement. A repayment plan called income-based repayment, that's an older plan. You're not going to be using that. You're going to be using pay or repay, but IBR started in 2009. So do the math, add 10 years to that, and then perhaps add another year or two for postponement or possibly switching jobs. And now you see that most borrowers, we think, are going to end up taking perhaps 11 to 12 years to qualify for PSLF. So if you simply take 10 years, add it to 2009, and then add another year or two, you got a lot of borrowers from medical school who should end up qualifying in the next few years. The counseling is far better than it was years ago. Borrowers now are better at tracking their payments. They know how to qualify. So we think many of you are going to see your colleagues from medical schools who graduated years ago start qualifying for PSLF in the next few years. In terms of resources to help, we've already referenced these, studentaid.gov/public service. This is where you pull down the PSLF form that you should submit every single year, and our homepage, PGPresents.com. We'll keep it as up to date as possible on program proposals and what kind of approvals are going through for PSLF. We hope the information in this module has helped. This is the end of module number 9.